Hello and welcome everybody to today's lunchtime webinar on managing high blood pressure, also known as hypertension. As I said, I'm Lisa Hines, I'm a health psychologist and I'm the head of health programs with Croí Heart and Stroke Centre. I'm delighted to be hosting today's important Q&A session with our panel of experts. And as Annie said, we have over 600 people registered for this webinar. So you're not alone in wanting to know more about blood pressure and ways that you can manage your blood pressure. A special shout out to the staff working in Portlaoise Hospital Cardiac Rehab and many of their patients who are here with us today. So welcome everybody. This is the second of a three-part Croí webinar series, and today's session is supported by Sláinte Care. This week we're delighted to welcome a diverse panel of experts in the area of high blood pressure. Professor Bill McEvoy is a consultant cardiologist in University Hospital Galway and a lecturer in NUI Galway. Dr. Gerry Molloy is a health psychologist and senior lecturer in NUI Galway, and Dr. Barry McDonnell is a cardiovascular physiologist working in the Cardiff Metropolitan University, where he is a reader in physiology. Thank you for joining us, Bill, Barry and Gerry, and all of you across Ireland who have logged in today. I think we even have a couple of people here from the UK, so welcome. We gathered a lot of great questions in the run up to this event from you all. And as Annie said, you're welcome to submit questions through the Q&A function during the session too. The questions are flying in already, so I'm going to do my best to bring them to our panel for discussion. We decided to focus today's event on high blood pressure or hypertension for a very good reason. Barry, would you like to tell us about that reason?
So essentially with hypertension, just this week it's been World Hypertension Day on Monday, and as part of that we've been working with Croí and with the Mayo Third Age Project to try and increase awareness of high blood pressure and the risks associated with it. In addition to that, that's been working with the May Measurement Month, which was a global blood pressure awareness campaign. So for this week, and essentially I guess why you've put on this webinar related to high blood pressure, well, it was the opportune time to get the message out, to try and get people aware about why and how to measure your blood pressure and how important it is to do that.
Fantastic, Barry, thank you. And we're really going to do a deep dive on that topic for this hour. So when we talk about blood pressure, what are we actually talking about, Bill?
So blood pressure is a reading, physiologic reading. It's the pressure in the arteries. Those pressure readings come in two varieties. One is what we call systolic blood pressure, and that's the blood pressure in the arteries when the heart is beating. It's in the process of contracting. And then the second number is the diastolic blood pressure, and that's the pressure in the arteries when the heart is relaxed in between beats. And so that's the top number is the systolic blood pressure when the heart is beating. The bottom number is the diastolic blood pressure, which is the pressure in between beats when the heart is relaxed.
Okay, thank you, Bill. And can you tell us what normal blood pressure means?
So if you look at the population and you look at the association between blood pressure readings and cardiovascular disease, you'll see that in general, the evidence would suggest that a quote-unquote normal blood pressure, one that's not likely to increase any risk for heart disease, is 120/80. So that's the systolic blood pressure of 120, the top number, and a diastolic blood pressure, or the bottom number, of 80. That's what we would consider normal blood pressure. There's a difference between normal blood pressure and high blood pressure or hypertension. And most definitions, although there has been some variability across professional societies, but most definitions for high blood pressure would be a systolic of between 130 to 140 or higher, and a diastolic of over 80 or more. Again, there is a little bit of controversy out there. Some guidelines, the European guideline, define hypertension as a systolic over 140 and a diastolic over 90, whereas the American guidelines say 130 over 80 is the cut point for high blood pressure. I think in general, I would say anything over 130 over 80 is going to be associated with increased risk of heart disease. Whether or not that needs treatment is an individual decision. but certainly what is normal would be considered 120 over 80 or lower.
Thank you, Bill. That's a really useful starting point. And you mentioned high blood pressure there, and the focus today is high blood pressure. So Barry, can you tell us why someone might develop high blood pressure?
Yeah, so there's a number of reasons why one would actually develop high blood pressure, but I guess as you age, that's one of the biggest determinants of it. And when you hit about 55, 60, your blood pressure, especially your systolic blood pressure that Bill mentioned previously, starts to go up quite rapidly as you age. Now that also coincides with the underlying vascular aging of the individual, where your arteries become stiffer and your systolic pressure essentially goes up as a result. And what's happening there is that the pressure in the arteries, because your arteries are starting to get stiffer because of aging, but that can be exaggerated as a result of bad lifestyle, poor diet, and so on. But that stiffness of the arteries actually relates to an inability to store and to buffer the volume that goes into the arteries. And then the pressure, the systolic pressure that Bill mentioned, which is the dynamic side of it, when the heart contracts, because there's no buffering there as you get older, the pressure then just continues to rise and systolic pressure goes up. So that's one of the biggest contributors to systolic blood pressure going up as you get older. And then again, that puts extra consequences or knock-on effects essentially into the brain, the eye, the kidneys and brain essentially, that will regulate the blood pressure also. So it's a vicious cycle essentially.
Okay, thank you, Barry. And to kind of address some of the kind of specific queries in relation to developing high blood pressure that some people have submitted to us, Bill, I wonder what you have anything to say on the fact that, say, a number of people have submitted questions about links between, say, hormones and blood pressure, or menopause and blood pressure. Do you have anything to say on that?
Excuse me, I'm on mute. Hormones and blood pressure, well, obviously there's a lot of different hormones in the body. I suppose when it comes to female hormones or female reproductive hormones, which fall in menopause, there may be an association there with increased risk for higher blood pressure and cardiovascular disease. It's not clear that that's the falling of the female reproductive hormones with menopause is a major factor in why older women tend to have higher blood pressure. And Barry already alluded to the idea that as we get older, the vessels tend to get a bit stiffer and the blood pressure tends to increase in a fairly gradual way as we age, and that happens for men and women. So I don't think the hormone side of things is very important, but again, for an individual, there might be some relevance. There are other hormones like adrenal gland hormones that are very important for blood pressure. I think it would be a bit complicated to get into that, but there are conditions that can increase the adrenal gland hormones, and we do, in some patients, evaluate patients for what we call secondary hypertension. Maybe it's an opportunity here now to just, without being too complicated, to mention that blood pressure, high blood pressure comes in two varieties. One is called primary hypertension or essential hypertension, and that's the commonest type of high blood pressure. 95% of patients with high blood pressure have primary or essential hypertension. And that's just a consequence of aging, genes, the environment. Nothing in particular is driving the high blood pressure, just the interaction of our genes and our environment and age. There is another type of high blood pressure called secondary hypertension, which is less common, 5% or so. And that's where patients have an underlying medical problem that drives up the blood pressure. And in some cases, there are adrenal gland hormone problems that can do that. But that's a rarer type of high blood pressure, probably not something we need to go into too much here. It's very medical, but just to note that hormones do play a role.
Thank you, Bill, really useful. And just to touch on it, because it does come up a bit while we're talking about high blood pressure, low blood pressure. Is that a problem? Where does that come from?
Maybe I can take that. The low blood pressure, that is something that comes up a lot, and it's a real concern for patients. There are a lot of people out there who tend to run low blood pressure, and it can be a source of concern for those people. I would say that there, in general, doesn't seem to be a lower blood pressure reading below which there appears to be an increased risk of heart disease. And so in general, we're kind of happy to hear when somebody says they want a low blood pressure from a heart disease point of view. However, what can happen with patients who have a quote unquote low blood pressure is they sometimes can feel symptoms of that. For instance, when they stand up, they might feel a little bit lightheaded for a period of time. Some patients have, lightheaded spells that may be related to low blood pressure as well. So my kind of answer to that is there's no one blood pressure reading below which you'd say that's low blood pressure. It really depends on how that person feels with the blood pressure reading that they have. If you had a blood pressure reading of 90/50 and you felt fine, I wouldn't be worried about that. If you had a blood pressure reading of 90/50 and you felt lightheaded every time you stood up, that's a different thing. So it's really, in my view, it's very driven by how the individual feels. Everybody's different. Their tolerance for certain blood pressure readings differ. That applies in the low side, but also the high side, by the way. Some patients with high blood pressure, readings of 160/100, they don't feel it. And other patients with the same reading are having headaches and other symptoms. And so we're all different and we all tolerate blood pressure in a different way. And for the low readings, it's all about how you feel. Certainly when it comes to blood treatment, blood pressure medications, if your readings are consistently, the top reading is consistently less than 100 and the bottom reading is consistently less than 60, you might be in a position where you could talk to your GP about reducing the blood pressure treatment that you're on. But again, if you were feeling well, I wouldn't be rushing into that. It would really depend on how you feel with the blood pressure reading that you have.
Okay, thank you, Bill. So really important to keep in mind that everyone is a bit different. Gerry, can I bring a question in relation to stress to you? I'm a little bit stressed by a leaf blower that's going on outside my house, so I'm very sorry if anyone can hear that. So I have a question here, Gerry, asking, does stress make my blood pressure go up? And if yes, will reducing stress make my blood pressure go down?
Okay, thanks for that question, Lisa. And I guess before I say yes, it's important to be clear about what we mean when we refer to stress. So stress it's a bit like the term well-being. It can be a moving target depending on the person and situation. For example, who would have thought that in 2019 that getting a haircut could be such an important source of well-being for so many people? I certainly wasn't interested in haircuts a couple of years ago, but I have been of late. More seriously, I guess most often when people use the term stress, they're talking about the feeling of being overwhelmed or unable to cope with mental or emotional pressure. So something potentially threatening or challenging happens, and stress results when you believe that you haven't got the personal resources to cope. Now, it's important to clarify that doesn't mean stress is all in your head or that you and your interpretation of the situation is the key thing. When you evaluate the impact of any life adversity, you consider your resources, things outside of your head. For example, we know that people with a secure financial situation or secure employment experience less stress than people who don't have those things. We know that people who have caring responsibilities for family members with serious health problems experience more stress on average than people that don't have those responsibilities. And we know that people who are socially isolated experience more stress than people who have more social connections. So these kinds of stress have been shown to be associated with increased risk of developing high blood pressure. So yes, stress can make your blood pressure go up. Now the question about whether reducing stress can make your blood pressure go down, well, potentially it can if reducing stress brings about a change in one of the factors that we know is involved in blood pressure control. For example, when people's emotions get out of control, which happens us all, we know that their behavior starts to get out of control as well, and that happens us all too. If we are stressed, it impacts on your relationships with others. You start to feel tired. You can't motivate yourself to take exercise. we struggle to get enough sleep, and our diet changes in ways that are not helpful for our blood pressure. So you might ask, well, then what helps for reducing stress? Well, regular physical activity is important. And you'll hear people say things like movement is medicine. The physical and the psychological benefits of a good walk are well established, and we know that that improves cardiovascular fitness, and that can reduce blood pressure and make us feel better. We also know that being among people that make you feel good is important. You don't necessarily have to talk about your problems. We see the benefits of just being around people. You know, that is sufficient in itself. So I know supportive relationships are not always available, particularly during the pandemic, but I guess technologies like this help provide a diluted form of that. But thankfully, I guess we're beginning to see a future where we can be around and among each other again. And then finally, I suppose behavioral factors that relate to stress or the reduction of stress are those things around smoking, alcohol, and caffeine. We know that these sort of things can be pleasurable, and we all need some pleasure in our life, particularly at the moment. But while those things might reduce our stress in the short term, we know that tobacco and excessive use of alcohol makes things much worse in the longer term for our stress levels and our overall physical and psychological health. We can see this when we don't have enough of them. If our capacity to stay calm is really affected by the absence of tobacco or alcohol or caffeine, then we might want to think about the impact of those things on our overall health. And then I suppose just finally on the reducing stress link with blood pressure reduction, there is a possibility of people practicing breathing techniques or other psychological approaches like mindfulness or cognitive behavioral therapy. That might be helpful too, and there's some readily available information through the HSE on the stress management program delivered by Jim White. So at stresscontrol.ie, people can find the link to that program, and that's a full cognitive behavioral therapy program that is evidence-based, that we know helps reduce stress. So I guess that's another thing people can do to help reduce stress. Is that okay, Lisa?
Absolutely, Gerry. That was really clear. You know, it shows how important it is for us to really think about what we mean when we say is there a relationship between blood pressure and stress. That's something that we kind of throw out there, but I think you provided a really clear description of what that actually means, and that there are things that we can do, a range of things that we can do in terms of looking at our stress and our the ways that we take care of ourselves through, you know, social supports and stress management, and then more behavioral things that can all be important for our blood pressure, but our overall stress as well. Thank you, Gerry. So it's really clear from the information that you have all provided so far that blood pressure is something that we should all know about. It's important. Sometimes it doesn't have any symptoms. We're all a little bit different when it comes to blood pressure, and there are a lot of things that we can do to manage blood pressure. Can I just check though, why is it that high blood pressure can have an impact on things like heart disease and stroke? What is the kind of pathway there, Barry or Bill, if you have anything to say on that?
Do you want me to go, Bill? And you
can we can both go, yeah. Yeah, you go first, Barry.
So from my perspective, again, it's a case that when your blood pressure is high, essentially it creates huge mechanical stress on the arteries that then gets transmitted right the way through to the microvessels in the eye, brain, kidney, and that the consequences of that is that you have tiny blood vessels, capillaries that allow the blood flow into those organs. So if your blood pressure is chronically high, every single time you have a heartbeat, it transmits that pressure, which can cause that mechanical damage to those tiny, really sensitive capillaries. And by doing that, you then start to impact on the perfusion or the amount of blood flow that you can get to that particular organ. So brain, that has consequences for particularly potentially cognitive impairment or cerebrovascular damage and so on. So, you know, these consequences of having high blood pressure chronically is a big issue. And again, a lot of it is determined by the output from the heart in combination with the vascular elasticity and ability to store that volume and then mitigate that pressure oscillation as it goes down to the end organs. And importantly as well, I guess, just to bring in there, is that when your blood pressure is high, especially when you've got this isolated systolic hypertension, which is essentially systolic blood pressure is high, and you get that big difference between the top number that Bill mentioned, systolic and diastolic, that creates a lot of turbulent flow in the system. And again, that is another consequence of knocking potentially thrombus or emboli that are stuck on the end of the edge of the artery wall away from the artery, and then sending it down along the arterial tree and then getting clogged in an area like the brain, causing a stroke. So there's huge consequences to that. So maintaining a blood pressure is really important from that perspective. So
yeah, I don't think I have a whole lot to add to that. It's a really great answer. You know, the one thing maybe I might add as a cardiologist, a heart doctor, and sometimes what I'll say to patients in the heart clinic, you know, every time your heart beats, it's pumping blood forward around the body, and the resistance to the beat or the heart beating or the work that the heart has to do to beat the blood forward or pump it forward is basically the blood pressure. And so the analogy I sometimes use is, imagine if you're lifting a dumbbell 60 times a minute. You know, you're gonna get tired, particularly if the dumbbell is heavy, and you can start to have the muscle get enlarged, and over time that can cause a lot of fatigue and stress on the muscle. Same with the heart, you know, so when the heart's beating 60 times a minute against a very high blood pressure, that's to work harder, it can get tighter. That contributes a little bit to this, but it's mostly actually to do with what Barry mentioned, where the small blood vessels get diseased and you're not getting as good blood flow into those vessels.
Thank you so much, Barry and Bill. Great to get a kind of a real visual of what is going on inside the body and how this all works. So then I suppose coming outside of the body again for a second and moving towards some questions that we've gathered and that we're getting on finding out about our blood pressure and how we might tackle our blood pressure. So to start first with monitoring of blood pressure. So a lot of people will be familiar with the experience of having their blood pressure measured, so the cuff on the arm. Can you explain that procedure to us, Barry, and what the numbers mean in a blood pressure reading? Actually, I suppose that's kind of been dealt with, but just in the context of that measure, can you explain it to us, Barry, a little bit, please?
Yeah. So when you put a blood pressure cuff around the arm, essentially what it does is when you press the button, it's a normal oscillometric device, press the button and it inflates the cuff to a point where it stops the blood flow into your arm. And then bit by bit, that pressure, the cuff deflates and the pressure drops by a few millimeters of mercury per stage. And then a point comes where the blood flow enters back into the system, and the bladder of the cuff is essentially measuring these oscillations. And then essentially it keeps decreasing and deflates, and it measures that pressure change as it deflates. And from that, the waveforms then you get from that, you can actually measure the systolic pressure, the diastolic pressure, and the mean pressure of the individual's brachial, which is their arm blood pressure. So that's what's happening. Yeah.
Okay, great to know. It's interesting how many things we, do in our daily lives that we couldn't actually explain or fully understand what's going on. So really useful to get a sense of that, Barry. Thank you. And Gerry, there's a question here about someone who says they suffer from white coat syndrome. So kind of struggles with going into the GP to get the blood pressure reading because they feel just very anxious about it and their blood pressure is through the roof as a result. Do you have any thoughts on what's happening there?
I guess in that case, it would be important to avail of some sort of home monitoring, such as ambulatory blood pressure monitoring, and that would provide a better assessment of how that person's blood pressure typically is. And if they have sustained high blood pressure, then treatment is needed. It's bad for you, I guess. Is white coat hypertension bad for you? It's bad for you if you have sustained high blood pressure on an ongoing basis, and that's not getting treated. So I guess for that person, it will be important to get an assessment outside of the context of that clinical encounter. You know, whether white coat hypertension is a problem in itself, my sense, and I'm not an expert in this area, in that particular area, is that the evidence is a bit mixed. But I think the important thing is if it does exist beyond the clinic, that elevated blood pressure, it's important that that is treated. So other forms of assessment, home monitoring or ambulatory blood pressure monitoring. You know, most GPs can provide that ambulatory blood pressure monitoring. It's readily available. So perhaps a discussion with the GP about that would be an important step for that person.
That's useful, Gerry. Thank you. Just remove the stressor. So then thinking about the kind of management side of things. So something our audience might hear a lot, and we in Croí talk about all the time, is the importance of knowing your numbers. We talked a little bit about the targets for blood pressure already. So why is it important when it comes to your heart health to know your numbers? And can you remind us of those numbers, Bill, please?
Yeah, well, knowing your numbers empowers you in terms of your own treatment, and I suppose gives you a little bit more understanding of how you're responding to treatment. And so I think knowing your numbers is giving you information that can help both in terms of understanding your risk for heart disease, but also understanding your response to treatment and whether or not anything further needs to be done. There are good data that home blood pressure recordings can provide information that are perhaps better than the readings we get in the office. That makes sense because when I say in the office, I mean in the clinical, outpatient department or the GP office. But obviously you spend 99% of your time at home, and you spend very little of your time with the GP, and blood pressure is quite a variable reading. It can vary from minute to minute, second to second even. And so the readings at home are more reflective of what your normal kind of exposure to blood pressure is. And so those readings can be a bit more accurate in terms of understanding the risk that you have relating to your blood pressure. Home blood pressure readings, obviously there are two main ways to measure home blood pressure. One is with an ambulatory blood pressure monitor, which is a device you get from your GP. Most patients will wear it for 24 hours. So we'll get daytime readings, nighttime readings. They can be repeated multiple times, but that's a device that you generally get off your GP. We can provide them in the hospital as well, these ambulatory blood pressure monitors. The other form of home blood pressure reading is the home blood pressure monitor, and that's the monitor that you can buy in the pharmacy or buy online. There are even now devices that can measure your blood pressure using a wrist-based cuff and that look like a watch, an Omron device, for example, that looks very much like a smartwatch, can measure your blood pressure. Those are blood pressure readings that you yourself can obtain anytime you want, any time of day. Patients who have those monitors often ask, how often should I take it? When should I take it? I suppose for me, it's important to stress to everybody on the line that checking your blood pressure at home is good, and it's definitely something to encourage. However, it needs to be done the right way. And if you're checking your blood pressure at home, it's important to follow a kind of stepwise approach. Number one, you should try and check it at a somewhat scheduled time, morning, evening, something that's scheduled and that you can kind of factor in maybe twice a week, whatever interval of time, if you want to do it every day, no problem, but that you're doing it at a similar time of day each time you measure. Because the blood pressure readings do vary over the course of the day naturally. They tend to be higher in the morning, lower at nighttime. But having it measured at a scheduled time so you can compare apples to apples over time is important. The other thing that's important is that you measure your blood pressure after 5 minutes at rest. The recommendation is that you're sitting down You don't have your knees or legs crossed, both feet are on the floor. The cuff and your arm is at the level of your heart, resting on a table or something that's at the level of your heart. And you wait for 5 minutes after sitting down before you measure your blood pressure. You don't measure your blood pressure in the heat of an argument. You don't measure your blood pressure when you're feeling really unwell. You don't measure your blood pressure when you've just had a coffee or a few drinks. Those kind of things can influence the reading. And it's better to have a more reliable, consistent reading by doing this, going through this stepwise approach. 5 minutes of rest, sitting down, not under any undue stress for other reasons, not having just had coffee, and then get the reading in that setting. And that's the more accurate reading that we like to see in the clinic. Keeping a diary of those readings is very helpful for the doctor, and so be very comfortable and confident bringing in all those numbers. Doctor can take through them. Information.
Thank you, Bill. We absolutely love to see people self-monitoring their blood pressure in Croí, and on the Croí website, croí.ie, we have a lovely video there describing what Bill so helpfully explained. If you would like to get a little bit of guidance, you can follow along with the Croí nurse in that video for using a home blood pressure self-monitoring device. So that idea of knowing your numbers, being aware, being informed, and bringing those numbers into your doctor. So Gerry, the whole kind of self-monitoring of our health, you know, that blood pressure example there that Bill outlined, you know, even our steps, we have more and more access to this kind of information. Bill touched on how often you should be doing this, but do you have anything to say on kind of maybe the effect of us being very aware of our own health and the level of monitoring that might be suitable for different people?
Yeah, it can be useful, Lisa, to do a certain amount of self-monitoring, obviously for blood pressure, but also for step counts. So I think there is a place for that, as Bill mentioned, doing it at routine times where it might become part of a habit that you do every day is a good idea. I think of obsessing about it and measuring anything too frequently is probably not a good idea, and you might actually get yourself in a state of agitation if you start to focus on something like blood pressure too frequently. So doing these things in moderation is important, and I guess there are diaries that specify the times or the frequencies with which blood pressure monitoring should be done. So I think, like everything, a bit of moderation with self-monitoring is important. I think with, let's say, step counters like pedometers that are on phones or smart watches, I think it's important that you set realistic goals for that, things that can fit into your life, and you gradually build them. So sometimes people hear about 10,000 steps as a goal to attain for good health. Now, there's no point setting a goal of 10,000 steps if currently you take about 2,000 steps on average. Maybe aiming for a 20% increase each week, and then reducing that to 10% increase each week after that. That makes sense. So sometimes you know, using the device to I suppose, yeah, setting a meaningful goal each day is valuable. So I guess that kind of way of knowing your numbers can be important for doing that movement as medicine piece. Yeah, there is a place for it, Lisa, but only if it works for you. You find it beneficial.
Yeah, good point, Gerry. Thank you. So we've kind of touched there on becoming aware of our blood pressure and how important that is. And now, in terms of the management, we're getting a lot of questions in about medications, and you've mentioned that medications are one of the ways to manage high blood pressure. So, Bill, I wonder, would you be able to comment on what blood pressure medications do for high blood pressure, and then we might move on to a couple of questions that I have about tolerating blood pressure medications.
Okay, yeah. So blood pressure medicines have different mechanisms of action. They all work similarly well. And so in general, there isn't at least in my view, and if you look at guidelines, clinical guidelines, in the views of other experts, there isn't one particular class of blood pressure medications that's the best, and they all work similarly well. The calcium channel blockers, which would be your amlodipine, your nifedipine, your lercanidipine, and the ACE inhibitors and ARBs or angiotensin receptor blockers, they all work very similarly, and those are generally considered the first line of treatment. There is another class of blood pressure medicines that work just as well, and some patients are started on them as first line therapy or second line therapy, but those would be called diuretics or thiazide diuretics. And I suppose the difference, just in broad terms, without getting into too much complexity, but the calcium channel blockers and the angiotensin receptor blockers and the ACE inhibitors all generally work by relaxing the blood vessels. So they cause what we call vasodilation. So instead of the blood vessels being kind of cramped or tight, they relax them, and that reduces the blood pressure in the vessel. Whereas the diuretics tend to work by having you pee more and having you pee out more salt in your urine, and that reduces the amount of volume of blood that you have in the body. But all those four classes, calcium channel blockers, ACE inhibitors, ARBs, diuretics, all work very well and to similar extents. And so there isn't one particular drug that is considered the best. It sometimes is a bit of a process working through with a patient to get them on a blood pressure medicine that works well for them and that they tolerate well. All these medicines have some side effects and everybody's different. And so you maybe started on a calcium channel blocker and maybe develop a side effect from that. One would be swelling in the ankles, and your doctor might put you onto an alternative like an ACE inhibitor or an ARB. And it's a little bit of hit and miss sometimes getting the right medicine for the right person so that they're doing well with their blood pressure and not having any side effects whatsoever. I think there are enough blood pressure treatment options, medication options out there that you should be able to get on a regimen that you can tolerate well without much side effects. And if you are having side effects, I would argue that it might be worth talking to your doctor to see if there are other options, because again, we do have a wide list of medicines that we can consider for the treatment of high blood pressure.
That's really interesting to hear, though, because you know, there really are a lot of questions coming in. You know, people reporting being very tired, experiencing pain and discomfort. Someone described having a very loud heartbeat. So a real range of things. You know, people are experiencing side effects, but you mentioned that the aim is actually zero side effects. So is it the case that it is about engaging with your GP on the trial and error, or you know, can you?
Well, I think so. You know, it can be challenging because the reality is we don't have any particular test that will say definitively that medication A is causing symptom B in any one person. So sometimes it can be hard to say for sure, particularly in older patients who are on a number of medications, whether or not the medications are causing the symptoms, and if the medications are causing the symptoms, which one of those medicines of the few that they're taking, and sometimes the many they're taking. And so it can be very challenging, and it's at times labor intensive. So I do think it's worth, if you feel that a blood pressure medicine is causing a side effect that is impairing your quality of life, I do think it's worth talking to your doctor. There are lots of different options out there. We certainly try different ones quite frequently, and we generally can get patients on a blood pressure regimen that they're tolerating well. There are some patients, I will say, that no matter what we do, no matter what medicines they get on, they feel side effects. But that's an unusual, pretty rare circumstance. It does happen. So if you're one of those people, you're not alone. It can be very challenging. But most patients can get onto a blood pressure regimen that they can tolerate and that can keep their blood pressure under control. And if you're not on a regimen that you're tolerating, if you're having side effects, there probably are other options that could be trialed, and it's worth talking to your doctor about that.
Thank you, Bill. That's very positive. If you don't mind, Bill, I'm going to continue with you with a couple more medication-specific questions. So Another person has asked, if your blood pressure is normal for 8 to 10 months after taking your blood pressure medicines, can you stop the medicines, or do you need to take them for the rest of your life?
Yeah, we get that question all the time. It's a really good question. It very much depends on the individual. Barry talked earlier about the relationship between age and blood pressure levels and how they tend to creep up as the blood vessels get stiffer over time, like every other part of the body can get a bit stiffer when we get older. And so by virtue of that relationship of a higher blood pressure tending to track with increasing age, if you're starting on a blood pressure medicine at age 50, it's unlikely that you'll be able to come off the blood pressure medicine by age 70, because the natural history of blood pressure tends to go up over time. But that's an average statement. So I would say on average, most people end up staying on the blood pressure medicines long term, but by no means does that mean that everybody needs to stay on medicines long term. And there are certainly some individuals who, for example, will come in with a high blood pressure, maybe at middle age, and are really, I suppose, have fallen off the wagon in terms of their lifestyle. You know, they're not exercising, they've gained weight, they're eating poorly, they're taking a lot of salt, a lot of processed foods, frozen foods, takeout. They're drinking heavily, they're under a lot of stress. This is common, this is very common. We see it all the time. And it's a bigger question how we can address those issues. But some people in that circumstance will come in with a high blood pressure reading, and we'll kind of get that eureka moment where they kind of say, okay, I need to kind of get the house in order here and make some changes to my lifestyle. And certainly there are many patients I've seen who have made big changes to lifestyle, lost a lot of weight, or become much more active, or really looked at what they're eating. And in that circumstance, there is a possibility that if you can sustain those positive, healthy changes to your lifestyle and your blood pressure comes down with those changes, that your doctor could try to wean you off the medicines. And if you're able to sustain those healthy changes, you may not need to go back on the medicine. And so I would say there are patients who can come off medicines if they make big changes and sustain them over time. That is challenging. It's not to say it's impossible, and patients do manage to do that. But I also would say that if you're struggling with maintaining those healthy changes, or despite your best efforts, you're not able to fully get there with your blood pressure and you need to stay on a medicine long term, you're certainly not alone. And most people end up needing to be on some blood pressure treatment for the longer term, largely due to the fact that blood pressure tends to get worse with age anyway. That's just a natural consequence of aging.
Yeah, brilliant stuff, Bill. Thank you. And I will come back to those kinds of lifestyle things in a moment, if you don't mind. I just want to touch on one more medication question. So does it matter if you forget to take your blood pressure medication from time to time? This person has said, my husband has my heart broken. I try to keep on top of it, but I know he's really bad at taking his medication regularly, and I'm worried that he's going to get a heart attack. Do you have anything to say to this person?
Well, again, you're not alone, and thank you for taking good care of your husband and worrying about this, because sometimes we do need support from others, and depending on personality, what's going on in people's lives, how busy they are, other things, just their own kind of disposition regarding medications and doctors and such. Having a family member that can help somebody stay on track is really, really key. So you're probably helping your husband quite a bit. All you can do is your best. If you miss medication from time to time, then I wouldn't be overtly worried if you can kind of just make sure you're doing your best at taking them as much as possible. Obviously, best case scenario is you don't miss the medicines. Worst case scenario is you stop taking them altogether. Anything in between is better than not taking them at all. And so we just say, do your best. Everybody's human. People make mistakes, and we're always going to have periods where, maybe we go away for a weekend or forget the medicines. These things happen, life happens, and you just get back on track as quickly as you can. there are some individuals who have very high blood pressures who wouldn't be very safe to stop the medications, even for brief periods of time. And so that's just something to bear in mind. And so I suppose maybe I should be saying that it's best if you do miss them that you get back on them as quickly as possible, because you might be one of those people who have very high blood pressure reading that could be dangerous. But most of the time, if you miss it for a day or two, recognizing that these things happen, I would just get back on it and get back on track and try and do your best, and just try to minimize the amount of days that you're missing the medicine.
And Gerry, would you have anything to add to that in terms of ways that people might be able to help themselves to remember or anything like that?
Yeah, so adherence is a struggle, as Bill has said. I think there's a couple of things people can do. Bill's touched on it, so I did think about this in advance, and I guess there's 4 quick things I'll say, and we use the memory aid of PILL, P-I-L-L. So the first thing is prompt. Use a prompt. Place the medications in a part of the house that they're likely to remind you to take them. For example, in the bathroom, beside the toothbrush. These visual reminders can work very well to trigger people to take the medication. The I was including others, and Bill has already spoken about that, where we have family members to remind us to take medication or to have them get the medicines for us so we have a regular supply. That is helpful for some. Sometimes that can be an annoyance, but as the saying goes, no man or no woman is an island in managing an illness. So we sometimes need that help. The L is link it to events. And I think this speaks to what Bill said earlier about getting a regular pattern of self-monitoring of blood pressure. Equally with taking medication, if you can link it to events that you do at set times every day, for example, taking medication at meal times, that can be a good way of taking medication and making it automatic. Maybe waking up and going to bed at night, that can also be a good regular time to place that link to taking your medication. And then the final L of PILL is let the doctors and the pharmacists know if you're struggling with the tablets and the quantity of them. They might have solutions. So as Bill said earlier, there's a lot of options prescribers have. There's combination pills that might be possible where you get multiple medications in one tablet. Now, it's not always possible depending on how your prescriber wants to manage the doses. So that's an option that might work for you. We know on average, the evidence shows that people are more likely to take medications where there's combination pills than each of the medications separately, particularly when they're taking a lot of medications. And the principle there is the more you simplify the task, the easier it is to complete. And I guess finally, the pharmacist might be able to supply your tablets in some kind of reminder packaging, and that might make it easier to track your medications. I think particularly where people have multiple health conditions and they may be on 10 or more tablets a day, those kind of packaging, that reminder packaging or dosette boxes, that might be something the pharmacists do. So do let your doctor or pharmacist know if you're struggling. They might be able to provide some of those solutions of combination therapies or particular kinds of packaging.
What an answer. Thank you, Gerry. That's really useful. So PILL is the acronym that we have in mind. We want to prompt ourselves, we want to include others, we want to link it to something else that we're doing, we want to let others know if we're struggling and we need some help. Brilliant. Thank you, Gerry. So we're moving into the last kind of 8 minutes of our time together. We've covered a huge amount, I think, and thank you again to the panel and to the Croí team that are working in the background. I wanted to kind of wrap up by moving into those lifestyle kind of behaviors and activities that we can do to really help us to keep our blood pressure healthy and manage our blood pressure if we do have high blood pressure. And then maybe some of the ways that we can support ourselves to do that. So Barry, I wonder, would you be able to remind us of those things that Bill touched on, those important behaviors when it comes to managing blood pressure?
Yeah, well, for me, physical activity is always the first port of call for managing blood pressure from a lifestyle perspective. because again, I feel like I'm consistently singing about the vascular stiffness or vascular health, but the underlying mechanisms by which your blood pressure goes up, if you exercise, you keep your arteries as healthy as possible for as long as possible, so you can mitigate that age-related increase in blood pressure if you maintain a healthy cardiovascular system. So exercise is by far one of the best ways to actually address that. So that would be the first and foremost. And again, a lot of the advice that is given, public health advice and clinicians give out in relation to managing your blood pressure, at least from a lifestyle perspective, is the usual stuff: a reduction in salt intake, the reduction in fat, sugar, food, alcohol, drinking alcohol in moderation. Again, like Bill suggested earlier, again, losing weight as well is another good way, and what Gerry was alluding to as well with the stress management side of things. And they all have a major role to play, or combinations of have a role to play, not only on the blood pressure, but the underlying health of your system. So that would be, they're the main ones that are addressed and are kind of promoted from a public health perspective consistently.
Yeah. Thank you, Barry. That's really useful and great to have those key things in mind, the exercise related things and the diet related things. And luckily, next Thursday at 11 a.m, Aisling Harris, the Croí dietitian, is going to be offering a HeartLink West chat webinar just like this one, that actually focuses on diet and eating for a healthy blood pressure. So you can find out more about that on our website. Gerry, I wonder if you would have anything to say on ways that we can support ourselves to make these kinds of healthy lifestyle changes. This can, we all, I suppose, know what we should be doing to keep ourselves healthy, more exercise and healthy eating and that type of thing, but it can be hard.
Yeah, so I think, as I mentioned earlier, doing things gradually is important, not taking on with too much in terms of physical activity, starting, finding out where you're at and then building on that. So that kind of gradual improvement and setting small achievable goals is really important. I think where it's possible to make these things more social and enjoyable, and again, I'm thinking about exercise, if you can take a walk with someone else, then, that I guess provides that kind of social commitment to another to engage in activity, but it also makes it more enjoyable. Not everyone enjoys out walking or exercise or cycling, but when you do these things with other people, it makes it more likely you'll do it and possibly makes it more enjoyable for people too. So I think, making the activity social would be important. And I think generally going easy on yourself. These things are difficult. It's not easy to initiate change and to sustain that change, particularly in the current circumstances. So I think setting small achievable goals for either changing your diet or changing your physical activity or cutting down on alcohol, or if it's smoking cessation as well, try and do that gradually, and don't be too hard on yourself if you don't manage to achieve what you want to achieve, and just keep at it, and do as much as is possible, and every little improvement counts. So every little bit of extra activity you do, consider that a success. So small achievable goals are important, and maybe involving other people in making those changes.
Thank you, Gerry. Really positive, useful tips there. So we are in the last couple of minutes now, and again, I think we've covered a huge amount, and I myself have learned a huge amount. So I very much hope that everyone who is with us here today has gotten something out of this session. And thank you so much for all of your questions and engagement. So before we wrap up, I would like to invite each of our speakers, if possible, to just give us your one key takeaway message. Barry, would you mind starting, please?
Yeah, I guess because it's May Measurement Month and World Hypertension Day was Monday, and the Mayo Third Age Project would essentially be to know your blood pressure, go out and get it checked. That would be my take-home message.
Excellent, thank you, Barry. Gerry, would you have one takeaway for our audience?
Yeah, thanks, Lisa. Well, I guess as we've all learned since March 2020, there's a lot of things in life that are not within our control. However, in most cases, blood pressure is very controllable with a bit of help from your healthcare provider, and finding a routine that works for you to manage your blood pressure.
Thank you, Gerry. And Bill, would you have a takeaway comment for us?
Yeah, I think cardiovascular disease is still the leading cause of death in the Western world, and blood pressure is the leading risk factor for cardiovascular disease. Of all the risk factors for premature death in Western society, blood pressure is top of the pile. So it often doesn't get the, I suppose, attention and respect it deserves. In the context of it being the strongest risk factor for heart disease, of all the risk factors out there, it's important to be proactive with your blood pressure and try and, if you're on treatment, try to have your blood pressure level less than 140/90 and closer to 130/80. That's my message.
Thank you so much to the panel. I have the leaf blower outside the window again, so please do wave if it's really clear. It's not too bad, okay. Annie, if you don't mind just making those final announcements, just so that sound isn't too distracting.
Yeah, absolutely. So bear with me one moment, everyone, and I'm just going to share my screen with you. Everybody can see that. Apologies now. To the next one. Yeah. So thanks again to everybody for joining. We had over 600 people registered for this event today. So obviously we didn't get to answer absolutely every question, but we would invite you, please, to make contact with our HeartLink West team. If there are some unanswered questions that you felt you'd like further information on today, you can call the number on the screen here or email healthteam@croí.ie, and we will arrange a call back for you with our nurse specialist and with the appropriate health team. And as Lisa mentioned, there is also a HeartLink West virtual chat next Thursday at 11 o'clock with our cardiac weight management dietitian, Aisling, on eating for a healthy blood pressure. And you can get the link to that by emailing healthteam@croí.ie or by hopping onto the Croí website, www.croí.ie. We would also ask you to save the date for the next webinar in our series, and that is June 24th. It's an evening webinar this time, and that's Living with Atrial Fibrillation. Again, it will be a 1-hour webinar, and we'll have another great panel to answer all your burning questions with regard to atrial fibrillation. So keep an eye out on our social media and website for further updates and information on that. And with that, I think that's everything. Lisa, have I forgotten anything there? Is there anything else to cover?
Just the feedback survey that will arrive.
Oh, the most important thing. Sorry, yes. You will be asked, once we close the webinar, you will be asked to complete a survey just about how you found the webinar and looking for suggestions for future webinars. So please do, we encourage you all to complete that webinar. We'd be very grateful if you could do that. It'll pop up on your screen or you'll get an email to complete. And also just remember that if you want to watch back this webinar, you can do so on our website, www.croí.ie. It'll be available there later on today. And once again, thank you so much to you all for joining. We're absolutely overwhelmed by the response and the registrations, and also to our panel for joining us today. Huge thank you for giving their time, and to Lisa for hosting. It's been a great event. Thank you, everybody.